Yes,
What
ma'am.
about the expansion of Medicaid?
Well, the expansion of Medicaid, and that's a really good, under the expansion of Medicaid, Virginia has foregone about $700 million this year so far. Well, more than $700 million. We've foregone probably about $1.3 billion in federal funding this year. Would have provided, that Medicaid expansion would have provided insurance to a few more than 1,000 people in the Allegheny Highlands, people in the city of Covington, towns of Clifton Forge and Iron Gate, and Allegheny County. It's a significant issue, but now we are stuck in the mud. We are going into session on the 22nd of September to talk about it. I don't know what kind of, I don't know, I remain hopeful. I remain hopeful that, I understand that even blind hogs find acorns from time to time. So I'm hopeful that we will have an open and honest discussion about it, but I'm not real encouraged that we'll move forward in September.
Well, we do so much on the federal marketplace, and we would have people that actually needed the care. They needed health insurance, and they fell through the cracks. We could not do one thing for them.
Well, there are approximately 800,000 or 900,000 Virginians who are uninsured. Mm-hmm. About 40% of those people would be eligible for Medicaid expansion if we were to adopt some form of it. That would mean about $2.1 billion a year for Virginia. Now the plan is that the feds pay the first 3 years of it, and now we've given up 3/4 of a year, so they pay the first 2.25 years. Then we pay up to 10% for the 3 years that follow that. And the way we've written the bill in Virginia, we would not pay anything more than 10%. Virginia, the bill we passed in the Senate says that we would pay no more than 10% after the 6th year. Of course, the issue that the people in the House of Delegates, and Terry, maybe you could address this, maybe you could put this on your shoulders. The issue they've raised is, well, what happens if federal funding drops below 90%? I don't know, 27 states have adopted it now, and I think if they drop the ball at the federal level, there are a whole lot of states that are going to be raising Cain about it, and I don't see that happening. But that's the discussion. I have had correspondence with the Speaker of the House about this as recently as yesterday. I mean, we continue to talk. I mean, there are I'm pretty sour on the political mood in Richmond. I think that it has gotten more like Washington. A lot of what's happened there has bled down. Virginia, is not. Think about this. When I was born 56 years ago, there were about 3.2 million Virginians. Now they're 800,000. 808 million, I'm sorry. Think about this. At the precipice of World War II, the largest counties from a population standpoint in Virginia, Pennsylvania and Wise. Now Fairfax County has 1.1 million by itself. Fairfax, Prince William, Loudoun, Arlington, Alexandria, that's 20% by the state's population and probably about 65 or 70% of its wealth. And then you add in Hampton Roads. So we're a different state than we were. And the political situation is more like Washington, but we continue to talk. We continue to have relationships.